We are in the process right now, probably in the next few days, of being able to actually give you information about individuals that are infected, individuals that are in the hospital, age ranges. I've had a lot of questions about the 2 individuals that died, and because we fortunately only have 2 deaths, I really don't want to give any more information because it's too distinguishable to those 2 individuals. But we are in the process of gathering that information, and we'll have some rough data for the governor, I think, later today or tomorrow.
Dr. Box, we've been hearing about this surge of patients, a surge of infected people. Are we seeing the beginning of that surge right now, given the numbers we saw yesterday versus today?
Well, I think we're testing more people. I think that's part of the difference there. And again, I expect those numbers to go up, so I don't want people to be panicked about it. But when you look at the numbers that we have in Marion County, that is concerning to me. And so as we look at that, when you have a number of people that are sick and in the hospital, that's that top 15 to 20%. But we know there's another of 80% of individuals, right, that are probably mildly ill or may be totally asymptomatic with this virus. So that is why we have the need for the social distancing. That is why we really need to adhere to this so we don't infect more of our at-risk population.
What about tests? When are we going to see more tests in the state and a greater testing to give us a bigger picture of what's going on?
You're seeing that ramp up right now. You will see that over the weekend, for sure.
Are all positive cases
Are we
here
going
in
to
Indiana?
see more drive-through COVID-19 testing? Other states are doing that. Florida, Washington, other states. Are we going to see more of that, particularly here in Indiana?
I personally see a role for a clinic or an area where individuals can be tested that need to be tested but maybe do not need to be in the emergency room. I do not see a need to test the young, basically healthy person or even children that have these symptoms, because that is not the population that we want to expend all of our resources on.
Why is there a discrepancy in numbers? For instance, the Floyd County Health Department has now confirmed 3 cases. Why is Indiana not giving as many frequent updates compared to Kentucky and other states?
So we are updating those numbers every day. We will have the numbers directly from our lab, and then oftentimes after we update that at 10 a.m., we will have other labs that are reporting to us positive cases, so LabCorp or other places, and we don't always have access to those. So as soon as we get those, they will go on the next day's numbers, and we will update.
Positive cases of people who are physically here in Indiana, are they here in Indiana or are they in other parts of the country?
You know, I cannot say that specifically, but they should be Hoosiers that are being tested right here.
So my question is, in Tippecanoe County, we had a person in Florida test positive, but they're from Tippecanoe County, but that was still counted here in Indiana. So how are we making sure that people are being double counted?
That is something that we know individuals are infected in other parts of the United States, and they are, once you're infected, really have to isolate where they are. They are not allowed to travel at that point in time. So consequently, those numbers will get counted where they individually are tested and positive and isolate.
But why are they being counted here in Indiana too? Because the one in Tippecanoe County was in Florida, but they're being counted in Tippecanoe County.
So probably they were tested at an outside lab, and Tippecanoe County reported that to us without the knowledge that they were in Florida.
How are hospitals equipped? We've been hearing about a nationwide shortage of protective gowns, protective masks, also breathing apparatus. Are hospitals equipped to handle this surge?
So our hospitals to date have been equipped to manage what they need. We do know that a couple of them are getting into that area where we're concerned that over the next 96 hours or so they could start to run short of certain things, and we do have the ability to replenish some of those for the hospitals. We do have the ability to replenish for the hospitals. We are continuing to put out the message that we need to conserve our personal protective equipment. That's why we don't want every individual in the state doing one test with all their PPE on, throwing it away, and then 2 hours later doing another one.
Governor, do you have any idea exactly how